Cancer patients are very likely to get blood clots. About 1 in 5 cancer patients will get a blood clot at some point during the natural course of their illness. And we know how to treat it based on randomized trials, but those trials have only gone for 6 months. And unfortunately, many cancer patients stop anticoagulation after 3 or 4 months, and so many more stop it at 6 months. And we don't really understand, if patients stay on the anticoagulation longer, is that preventing the clots from coming back, or is it of no use beyond the 6-month time point? Because that's not an issue that's been addressed by clinical trials. But there are other ways to get data other than randomized trials, and so we looked at sort of a big data analysis of prescription patterns in the United States, and we were able to link the prescription data sets with outcomes such as recurrence of blood clot. And so we took cancer patients who had been started on an anticoagulation, and we looked at patients who stopped at 3 months, patients who stopped at 6 months, and patients who stopped at 9 months. And the longer they stayed on anticoagulation, the less a chance that the clot would come back. And once you got to the 6 to 9 month mark, it was about half the chance that the clot would come back if anticoagulation was continued. So that, I think, adds to sort of the knowledge in this area. We don't have trial evidence, but we have this evidence and some other evidence like this that suggests that staying on anticoagulation longer prevents recurrent clot. We did, in general, it didn't matter what agent you were on as long as you stayed longer. However, patients who stayed longer were more likely to use an oral agent because it's more convenient and it's easier to use. So, yeah. We looked at different types of cancers too, but that didn't seem to play a role. It was really, did you stay on a blood thinner or not? If you did, then you had less of a chance of the clot coming back. This supports continuing anticoagulation indefinitely in cancer patients who have active cancer. So it's not cancer patients who had surgery and the cancer was taken out and they had a clot right after the surgery, and now it's six months later and there's no evidence of cancer. In those patients, I would stop. But patients who have active cancer and they're metastatic disease, they're going to be on chemotherapy for the next year or 2 years or 3 years, I would keep them on some form of anticoagulation.